Howdy, my name is Mikaela Sebastyn. I am a second-year veterinary student at the Texas A&M College of Veterinary Medicine and Biomedical Sciences. And today, on behalf of the PEER program, we are going to take you through a special 2-video series on infectious diseases. In this video, we'll talk about infectious agents, where they can be found, and introduce you to some of the most common types of infectious diseases. Microbes are microscopic organisms that can live almost anywhere. Different microbes have different habitat preferences, ranging from extreme heat to extreme cold. Some microbes need oxygen, while others do not. Most microbes can live in a variety of habitats, but they can only thrive in a few habitats. We even have microbes in our bodies. Some help us out with a variety of functions, such as digestion, and some can hurt us, especially if there is an impairment in an organ or tissue. It is also useful to compare microbes with cells in multicellular organisms. For more information, visit Cells Are Us in the link below. Most microbes belong to one of 5 categories: bacteria, viruses, prions, protozoa, or fungi. Some microbes cause disease and some don't. Microbes that cause disease are called infectious agents, but they are also commonly called germs or bugs. Infectious agents all look different depending on each of their class. Bacteria, protozoa, and fungi can be seen with a light microscope, while viruses and prions are so small that they can only be seen with an electron microscope. Bacteria are prokaryotic, unicellular microbes that have their own metabolism. There are countless numbers of bacteria on the earth, but less than 1% of them cause disease in humans. Bacteria can live in a vast range of places, but need energy sources to thrive. Some bacteria even produce toxins that can harm us. Some examples of bacteria include tetanus, E. coli, and salmonella. A virus is a microbe that consists of nucleic acid housed within a protective coat. The virus reproduces by hijacking the host cell's metabolic machinery to replicate its own DNA or RNA. Most viruses cause disease and are specific as to which type of cell they will attack. Some examples of viruses include the flu virus, smallpox, and measles. A prion is an infectious particle made from an abnormally folded protein found on the surface of neurons. Prions are highly resistant to heat, UV radiation, and disinfectants. The best-known prion forms holes in the brain tissue, causing mad cow disease in the bovine species. Other examples of diseases involving prions include chronic wasting disease in deer and scrapie in sheep. Protozoa are one-celled microbes that can be parasites or predators. They can live in a variety of places, but most prefer moist habitats. They cause disease in humans, but are sometimes helpful to other animals. They are a good source for whales and can help cows as well as termites digest their food. An example of a protozoan infection in humans is malaria, which is spread by mosquitoes. Fungus, or fungi, is a multicellular microbe that is much larger than other microbes. Only about half of all fungi in the world cause disease in humans. A fungal disease is called a mycosis. A few examples of fungi include dermatophytes or ringworm and yeasts such as Candida albicans. Infectious agents can enter through a variety of routes, such as the air or food. The body's reaction to an infection can vary depending on the agent. For more information on bodily reactions, visit the link below. Bacteria, protozoa, and fungi can all reside in soil. Other infectious agents can live on surfaces for hours or even days, like the cold virus. This is why sanitary practices are needed to help prevent infections. Once a few microbes enter the body, it may take a few hours or days for the agent to reproduce enough to become infectious for others or to cause disease. This time period is called the incubation period. If the agent is inactive or dormant in the body, it is called the latent period. Note that a person can be infectious for a disease even before and after the onset of disease. Infectious diseases cause more deaths worldwide than any other single cause. They account for over half of deaths in developing countries. However, these diseases account for only 8% of deaths in rich countries. This is often due to availability of clean water and food sources, ability to create vaccines and medicine, sanitation practices, and good nutrition and public health programs. There are many types of infectious diseases, which include food poisoning, respiratory disease, liver disease, and sexually transmitted disease. Let's look at each individually. Classical food poisoning is from foods contaminated with enterotoxins. Bacterial food poisoning, on the other hand, is caused by bacteria itself, not the toxin it produces. Both types of food poisoning, however, have similar symptoms. Notice this cartoon of a hamburger. If you ever bother to read the bottom of a menu from a restaurant that serves beef or eggs, you'll note how they put food safety warnings that remind you of the risk involved if you consume undercooked meat or eggs. Take a moment to look at this list of food poisoning symptoms. Have you personally experienced these symptoms in the past? Note that botulism is caused by the bacteria Clostridium botulinum, which secretes a neurotoxin that causes paralysis and eventually leads to the symptoms listed on the bottom. Classical food poisoning can be prevented by better food storage and handling techniques. Places where outbreaks can occur include picnics, cafeterias, or just about any place where food is not properly stored or handled. Almost any food can carry infectious agents. Raw or processed meat, eggs, or any cold food item are favorite places where microbes can grow and cause illness. Bottom line is this: be careful where you get your food and make sure you practice good food safety techniques. There are many infectious agents that attack the respiratory system. The most common respiratory disease is cold, but others may include bronchitis, influenza, SARS, and pneumonia. Some likely routes of infection include sneezing or coughing on or near another person or object, and breathing in dust or contaminated air. Most liver diseases are caused by a variety of viruses known as hepacovirus. These viruses can cause hepatitis, or inflammation of the liver. You may not remember, but you were probably vaccinated for hepatitis A virus at some point. Look at this image on the right. Note the cells on the far left are from a normal, healthy liver, while the other two images are of liver cells affected with hepatitis. Sexually transmitted diseases, or STDs, are a result of various viral and bacterial infections that are transmitted via sexual interactions or even through blood or serum exchange. Today, there are more than 20 identified STDs. The most common include chlamydia, syphilis, AIDS, and herpes. You most likely struggled with acne as a teenager. If you're curious as to what causes it, keep listening. Pimples are basically dead white blood cells that attack bacteria in the skin's pores. In your skin, you have sebaceous glands that make an oily substance called sebum, which is made of lipids. If you produce too much sebum, It can clog your hair follicles, allowing bacteria to grow and multiply. This provokes white blood cells to rush to the site and to fight the infection. Stay tuned for Infectious Diseases Part 2. Thanks for watching.